Hi everybody, we're very excited to be doing another Facebook Live here from German Veterinary Clinic. So for those who it's the first time watching, my name is Nora. I'm a veterinary nurse with a special interest in feline behavior and everything fear-free, and I'm the clinical manager here at GVC, and this is my awesome colleague Ilse.
Hi, I'm Ilse and I'm part of the behavior and training team. My focus is more on canine behavior. And we're excited to show you guys today how we prepare for consultations for both feline and canine patients.
Yes, the idea today is that you can get some good tips both as a pet owner but also as a veterinary nurse or as a vet who wants to introduce some fear-free techniques to practice. So we started here in our reception because this is really where the pet's journey starts. So we have an amazing reception team that are really great at helping owners prepare at home. So there's lots and lots of things you can do, and I think we'll do a whole different live on that at some point about how you prepare your animal at home, some medications you can give them, some steps you can take while traveling in the car. But the big point we want to make today is that our reception is kept with noise to a minimum. We have classical music playing all the time, and our amazing receptionists stagger the appointments in a way that we ideally don't have two animals arriving at the same time, and they're able to go straight into the consultation rooms.
Yeah.
So should we head on in?
Yeah, let's head on in.
Cool. We're going to go just to our dog consult room. So we've got 2 cat, 2 dog.
My favorite place.
The bigger one. And Ilse is going to talk through the preparation that is done ahead of a canine appointment here at a fear-free clinic.
Yeah, so, wait, let me just come in front of the camera. Alrighty, so the door behind me, so we actually have a separate entrance for our canine patients. So the parking lot is over there and they can come in through the side door, everything, so the little stairs are non-slip, all of that. What we do is, so before we have a consultation, so this is just kind of generally what we do. So it is very much individual for every single patient, and we do the same for our feline patients, and Nora will chat more about that. So before we see any patient, the most important thing, of course, is to familiarize ourselves with what we refer to as a fear-free questionnaire. So every client gets sent a fear-free questionnaire, especially when they're new, so that we have an idea of what are their previous experiences at the vet, what are their favorite things, do they enjoy toys, do they enjoy what particular snacks do they enjoy, are they worried about anything in particular, and we adapt and become very mindful of those preferences. So if we know, for example, okay, it is going to be a dog that's a little bit more anxious, we've got a couple of those, and they, for example, coming in with for a vaccination, what we do is, over here, we've actually got a separate, so you'll see behind me, there's the fridge. That's where we store our vaccines and all our other kind of things that we use more frequently within a consult, so that the nursing team can prepare everything, so that we know we don't have to kind of, be rustling around and all of that. So depending on the patient that comes in, we also look at previous, so if it's an existing patient and we've seen them a couple of times, we look at what we refer to as an EMR, so that is an emotional medical record. So how have they been previously, what were their preferences previously, what worked before, what didn't work before. So we completely prepared, so we have a plan in place. Does it mean we need to be a little bit more mindful of their space? Does it mean that we need to make sure that we get fresh chicken in for them, for example? So we make sure that all of those things are prepped. So in terms of, I'm just going to flip this a little bit this way. So over here, so as we enter, what's really cool is we have where the vets will take their notes. We already have toys available and we've got snacks available, so we don't have to move too much in order to, for example, feed snacks if they can have snacks. So if it is a patient that we know, for example, has to go under general anesthesia or they need to be prepped for a procedure and they can't have any food, we have other options. I don't know if I should move it around or... on that same note, so we kind of separate. What's really great about this room is, and it's the same with the other dog consult, is we make sure that no matter where the where the clinical team is, they have access to a reinforcer. So they have access to whether it's toys, so they don't have to move around too much. Because again, depending on the patient, are they a little bit sensitive to people moving in their space? So we've got so over here, we have a little treat station. So on this side, so we make sure that we have a variety of snacks. We always have hypoallergenic, just because we know that quite a few of our patients might have, whether it's gastrointestinal or skin, we make sure that we have hypoallergenic. Thank goodness most of the dogs actually enjoy them. Clearly Ilse did something right by getting that taste right. And then, of course, our puree and all of that. We've got an air purifier that also just helps in terms of scent. We know that, of course, they're very sensitive, and I know with the cats they're also very sensitive, just to be sure that it just helps with the odors. We make sure that we've got everything pre-prepped, so everything that we will use very, very often is already pre-prepped. We make sure that everything in addition that the nurses might need is also on this side. So whether it's gloves, whether it's syringes, everything is kind of on this side of the room. So this is kind of like the prep area. And then, of course, we've got classical music, which is on.
I'm going to go ahead and ask a question. So
yeah.
Even though I'm a veterinary nurse for a long time, I don't get dogs the way you do. So can you maybe explain like why we want everything in the room? Like it's triggering, am I right? Like for dogs that can be
yes.
to come in and out in the traffic.
Absolutely. And we do know with quite a lot of dogs, because they live in our environment, and we know that delivery people, whenever there's guests or owners, we kind of often refer to a door as a kind of hotspot, right? That's where the action happens. We also know that dogs are, regardless of breed, they let us know when there's a change in environment, because that's how we selected them, right? So in terms of, there's someone on the property, or there's someone coming in. So they are genetically predisposed to be a little bit more hypervigilant, I guess, than cats in terms of a change in environment. So if we keep coming in and out of the door, we might have a situation where the dog has finally come down to an FAS 2 or even FAS 1, and then if there's movement and a door opening, again, it could potentially escalate it. So we want to make sure that we keep it like a little bubble for them. Of course, it does happen depending on for example, if we have to run bloods and the nurses have to go upstairs to our lab, of course that happens. But again, if the FAS, for example, is extremely high with this particular individual, we might prep it so that we know it might be, one of the nurses actually waiting outside, and they just hand the sample to run upstairs. So again, it's just, each one is an individual. Yeah. So we want to kind of, and this is also why it's set up this way, this kind of split between, this is where all the prep stuff is. So on that side, it's just the reinforcers. That's really kind of, so we don't have to keep crossing into their space.
Well, you're mentioning FAS. I just think this is really good. So FAS is for fear, anxiety, and stress. So we have these great scales through Fear Free where we actually measure their fear, anxiety, and stress, or FAS. And that sort of tells us where we are with the dog or the cat in the moment. So these are really handy too for pet owners at home to kind of know, what kind of mood their animal's in, if it's the right time to proceed with a vet visit, that sort of thing. So these are really, really handy.
And it's also great for us to be able to refer as it's potentially escalating or de-escalating. It's also good to refer the clients to it so that they can, it's got a little bit of an education piece to it. And of course it's helpful, for us. Because sometimes we kind of, you kind of sometimes can get a little bit in the moment. Then I'm going to flip everything around. And now we've got the other side. So over here we have, again, 2 snack stations. So again, variety of snacks for the patient. Again, so it would be, let's say the dog is becoming really comfortable. The patient's really become comfortable on the as you guys can see, no examination table, because we examine all our canine patients on the floor, because we know that's where they're the most comfortable. A lot of times they unfortunately shut down when they get lifted. So we would, go on their level, again, depending on the patient. Some patients prefer us to already be in position so that there's even less change in the environment. Other dogs are, again, it really depends on the patient, and we make sure that we have that plan in place before the client and the patient even arrive at the clinic, based on their previous experiences and their emotional medical record. Yes, so then we have our scale. So over here, as you guys can see, so we refer to it as a magic carpet. So you guys can see that it is a non-slip yoga mat that we lay out. So what would be very, I'm just going to see. So what would be very, beneficial for us is the dog can actually come in through the door once they have settled a little bit. Again, depending on the patient, we might even so all of this is also pre-sprayed with Adaptil. So over here we've got our Sniffle mat. We pre-spray that with Adaptil. We might put, if we know the dog likes, for example, salmon snacks, and it's okay for them depending on what they're coming in for. So if it's just a general checkup and a vaccination, we can already put the snacks in. So by the time they come in, they can literally come through the door, ooh, I already have snacks, it's already a positive experience. And then from there, it's quite easy for us and them to just get onto the scale. So it's not just this big black floating platform on the floor. We actually have a very clear, designated non-slip pathway for them. And of course, we can hansel and gretel them. That's what I call it. So you kind of just like place little snacks on to get them onto the scale.
I think what's good about that is that a lot of dogs we see will have had bad experiences in the past at a veterinary clinic. Not necessarily bad out of any ill intention, but bad because they felt sick or bad because they weren't properly prepared. And these big scales are something that they only see in a vet clinic, right? It's not something that you have at home or you see when you go out for a walk. It is very specific to the veterinary clinic. So fear-free isn't just about preparing from puppyhood for the perfect vet-animal relationship. It's also about addressing these previous issues that have happened. And we know scales are one of the things that we'll only see at a vet clinic. So Ilse concealing it like this is just sort of another way to think outside the box and hopefully engage them a little bit more in their visit.
Exactly. And then blankets pre-sprayed. We make sure that, again, if let's say it gets soiled during it, or we see that potentially the dog is still a little bit fearful, we can always come out and kind of either make it a little bit wider for them, or even potentially longer. And again, everything, we completely set up this room so that no matter where you are and what you need, we don't want to get up, to kind of go and get it. Everything is within reach. Now, my favorite corner of the room is kind of like our our reinforcement corner. So over here we of course have our snacks. In terms of what is reinforcing for the dog, again, we have a look at, they all have their own preferences, the kind of snacks that they want. Again, depending on the procedure, we make sure that we have an array of different reinforcers, which does not only include food, of course. So behind me, we've got a scent library that we stock. So we've got various kinds of scents that we bring in, safe scents that we bring in from outside. So whether it's a little bit of horse hay, or it is literally leaves and grass and all sorts of other interesting scents for the dogs. We bring them in, we keep it stocked, so that, again, don't have to move too much. We have created a little bit of a scent box for them. So if we know the patient really, and we know dogs love sniffing, it gives them information, it keeps them occupied. So we literally fill these little bags every day. We keep rotating them with different, so this is leaves by the smell and sound of it. In here, I think there's a little bit of rocks in there with maybe a little bit of herbs. And I think this one has got sand from outside. And we make sure that they are placed inside so that in case we have any dogs that kind of would like to eat something, we obviously don't want to, we want to make sure that they can't. So with these kind of like little air vents, they're able to sniff it. Depending on the size of the dog, we might open it slightly for them to have a better sniff, and it just redirects them away. Again, very easy to get out. Then we've got puzzles. So if we've got a dog that just needs a little bit more engagement, it keeps them a little bit more focused away. So for example, if we do a blood draw and we want to really keep the dog occupied, or they're not that happy with us kind of feeding them directly into their mouth, similar to a licky mat, it just keeps them occupied for a little bit longer. Another reinforcer is of course toys. So we have our toy box. Again, right here we've got squeakers, we've got different ones, we've got different, here's like a little rubber one. So we've got, again, whatever the dog's preference is. We know that different dogs like different kind of toys, so we make sure that we have options available. And then one that is really, really great is brushes. So we've got a variety of brushes. So some dogs really enjoy, because some dogs really, if I just kind of think, there's about 2 patients I can think of just off the top of my head, their owners, it's a bonding experience with their owner, where they get groomed every night. And it's either, you know, the owner can sit with them and they can be on the owner's lap and they can groom, and we've got different options depending on what, the dog's preference is. So touch can also be very reinforcing for some dogs, and a lot of times we forget that. I know with kitty cats that's something that is quite often used. And then also what I have over here, so some of our patients have done training with myself. They have done, for example, one of the puppy life skills things. And what we do with this is, I'm just thinking we actually have a patient coming in later today, and we're going to use this with him. One of his favorite tricks to do is paws up. So that's essentially just him putting his 2 front feet up. He's engaged with the owner. It's very easy for us to then do a vaccination, because he's actually, I think he's coming for a Cytopoint injection. So his little feet are always on here. He gets his little snacks. He's focusing on mom and dad. Come in, quick little injection, and it just becomes part of his trick. So we always make sure that we have this available as well for those patients that we know, and we can check on the emotional medical record, because I will put on there the dogs that I've worked with and what their favorite trick is, bearing in mind that we can actually use that because they also find that reinforcing, because it's fun. They've got a very, very long reinforcement history. He literally runs in, this thing is right there, and the first thing he does is he goes and he paws up. So before even going to the scale, paws up is his thing. So it's something that we also incorporate. And then of course, from a safety point of view, we have our muzzles available. So we've got an array of different muzzle sizes. So this is of course a safety precaution. It might reach a stage where, and again, we have to triage what is important within that situation. So let's say there's a dog that absolutely needs, they might be in a position where I'm thinking a couple of weeks ago, we had a dog that came in, they had an allergic reaction to an insect bite. FAS got really high. We had to give an injection because we were concerned that the dog might go into anaphylactic shock, right? However, we need to make sure that our clinical team is protected, that the dog is also protected. So muzzles do come in handy when it comes to that thing. It's just, again, a layer of safety. Now what we do here, and again, because the muzzles are here, and you will see, oh wait, just in reach. We use one of Nora's favorite snacks, and I'm sure she's going to talk about this, pur puree, or you can even use peanut butter or cheese, but generally the pur puree works. We have either tuna or chicken. So just, again, depending on what the dog's preference is. And what we do is, so we'll never just go and shove the muzzle on a dog's face. So one of the things that we do is depending on how the dog feels, it will either be the owner that will kind of demonstrate and instruct, or we will do it where we're not facing the dog. We place, and this is just a little tip for some of you who work in the clinics, we place the muzzle on the floor, we take the puree, we squeeze a lot in there, and as the dog goes, they are going to get a very high reinforcer. They lick, 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 and we can go and secure the muzzle And once the food there is done, my goodness, it doesn't want to go in. You will have 2 hands for this because you don't have to hold that because the nose will be in there. And then as they lift up, we can keep feeding. So again, it's a positive experience. We'll never just shove the muzzle on. If it is a case where the patient can't necessarily have a whole bunch of snacks, again, what we can do is we can even keep, you know, we can go to the library, you can get something that's a little bit more enticing for them in terms of sniffing, and we do the same principle. So we have the sniffy there. As they're sniffing, we can even have 2 bags, and we keep rotating them, i.e. nose goes in order to sniff. So that's a little trick that we use quite often. Well, when we do place muzzles, we do have, you know, we always advise and that's kind of part of and we'll probably do a Facebook Live on it, as Nora said before, in terms of pre-prep. Muzzle training is extremely important. I cannot say it enough in terms of, it's like, we all want to teach our dogs how to walk nicely on a lead. We all want to teach our dogs how to wear a harness. A muzzle is exactly the same thing. We just never ever know when we're going to need to use a muzzle. For example, if you've got a dog that eats anything off the floor, a muzzle is great for those walks so they don't get a foreign body, for example. We've seen that quite often. And the problem is that if we don't do that initial training with it, unfortunately, they might have a very negative experience. And then we sit in a position, unfortunately, we have seen it before, where we do exactly this with the muzzle, and then their FAS escalates because the muzzle has got such a negative experience. So yeah, but we'll do a Facebook Live on that before I completely just keep talking about muzzles. Oh yes, and then of course we've got all our, I did already mention our pre-sprayed blankets. So what's quite nice is we make sure that we've got a very nice flow in terms of where the patient is. So we have like a sacred space for the patient. We make sure that everything we need is at a distance. We don't have to go into their space. We don't have to move fast. Yeah, I think that's it for the dog consult. Cool. Is there anything you want to add or anything you want to ask while we're here? Oh, it's of course a dactyl.
Yes,
diffuser.
definitely.
A dactyl diffuser. Again, I'm so used to some of these things, it doesn't even strike me as something, you know, out of the ordinary.
Yeah.
So yeah,
I actually learned a lot about dogs today. If you did have any questions, you can send them at any point now or after. But I think it's cat time.
Yeah, kitty cat time. So
okay. So just to the other side of our reception is our first of our 2 cat consult rooms. So this room is very important to me. I think it is really a beautiful space. It's quite a homely space, and we want to make it as cat friendly as possible. So come on in, and I will show you how I prepare. Oh, yeah.
Signs up. We've got the same with the doggos, but yeah, just sign up. Oh my goodness.
Okay, so what we have tried to do, so we are coming up to being 10 years of a gold standard cat-friendly clinic. We were the first one in the Middle East, and cat-friendly clinic is just such an amazing initiative within veterinary. I've been lucky to work in this way for a very long time, but the idea behind it is that we're respecting cats as their own species. Traditionally in veterinary, I think cats were kind of treated as small dogs, and we thought a lot of the same things applied to both, but we know cats are very much their own thing, and they are super amazing. So something that we try to do with every consult, with every interaction, is make sure that we are providing cats with what's called the 5 pillars of feline ownership. But the ownership can be applied here to clinic too. I think it's more about feline needs and feline interactions. So everything about our consults is trying to address these 5 pillars, which we'll go through, and I'll show you how they can be integrated into any veterinary consultation room. But same as the doggies, we always read the fear-free questionnaire or the emotional medical record, or what's probably most commonly done and something that's very easily adaptable is we make sure to leave highly visible notes about patients for each other. So really good communication within the team is really crucial to practicing in a cat-friendly and fear-free way. Things like, George loves Sarah, or which is a cat who absolutely loved one of the nurses, Sarah, or Freddie loves puree, does not like catnip. Little things like that, if you've acknowledged in a consult, you make sure that everybody else who has the opportunity of meeting that cat knows those things in advance, so that each consultation or visit to the veterinary visit they have is even more preemptive and thoughtful for your pet. If you have a cat or dog who's ever come to GVC, I can guarantee you there's notes about them on our computer system about their likes and dislikes. It's something that we really value and just makes the whole process easier. So when we're talking about pillars, I think the first pillar that I find really important for treating vets in clinic is a safe space. Really important that cats have the ability to feel safe and secure when they're coming for a checkup, or they're sick, or a vaccine, or any reason that they're coming. So an easy way we can do that is when they're in the carrier, we just create a little tent. So instead of just taking the cat out of the carrier, you just create a tent with a blanket and you're able just to examine them as is. Alternatively, when we do let cats out to play and explore, we make sure that they have hiding spaces. So these boxes are amazing. They're from IKEA, but you can replicate them anywhere. And the whole idea is lots of times if cats are out and about exploring and they are going to be a bit nervous at the clinic, they might go in, they feel quite safe in there. Once the vet has gathered all the information they need to from the client, they're able to use a little blanket, let the kitty remain hiding, cover up, do the exam as much as possible, everything that's needed inside their little safe place, and then often placing the carrier next to it, the kitty will just run back into the carrier. So it's providing these safe places wherever possible. We've got some there. I think the biggest safe place is with the owner sometimes. So that's a big one for us, as we try to keep the owners involved with their actual appointment and treatment time as much as possible. So if you are a nurse or technician or vet, really consider drawing bloods, doing nail trims, all those things with the owner present, because that can be the safest place of all. So the next on the pillars we're going to talk about is multiple and separate resources. That's a little bit tricky in a vet clinic, and sometimes it's not always appropriate for cats to eat and drink and use the litter, but we want to provide those opportunities and make sure all of their needs are met at all times. So in the consultation room, where appropriate, so we don't have an urgent urine sample to get aseptically, we can have this litter tray in the corner, especially for cats who've had a long journey. We make sure to have that there, and we'd have water provided. Again, here in Abu Dhabi, it's super hot, so we want to make sure cats have access. And then the most important resource for our kitty cats is treats. So we have in both our cat consult rooms, as well as every single treatment space, so the hospital, even the ops room, we have treats available everywhere. We have a few different types, but definitely my all-time favorite is the Kit Kat Pure Puree. I cannot do my job without this. It is a miracle, and we use it constantly. Every single appointment we have for cats, we use this stuff. So it works really well. I think the fishy ones are the best, but we have pots like this literally spread throughout the clinic so that all of our team can grab it at any point. It's great for getting a cat out of the carrier. It's great for getting them back into the carrier. It's great for giving an injection. It's great for trimming nails. There's nothing it can't be used for. So lots and lots of this stuff for sure is always going to be a winner. One of the other pillars that is very, very applicable to veterinary clinic is respecting a cat's sense of smell. So when I come into the cat consult room, if I'm preparing for a visit, the first thing I do is I check the smell. If we have had, let's say, an unneutered cat in here, sometimes the room just has to be deep cleaned before we bring anybody else in. Cats have a very, very advanced sense of smell, and we want to make sure that we are respecting that at all times. So we keep things very neutral. The team does not wear perfumes. We make sure to always have Fellaway, which is an artificial facial pheromone of cats. We have that both in plug-in form and also spray for our blankets. I've been using Fellaway as perfume on the job for a long time, and I think it helps. I probably use too much of it, but the idea is that you want to have this smell on the blanket or on you, and spray about 10 or 15 minutes before actually being near the patient, because there is an alcohol base to phenolate and adaptyl spray, and that can be a little bit off-putting for cats and dogs. So if you do use those products and you want to spray them, just give yourself a bit of time between spraying and actual contact with your patient. Positive, so going down the list of pillars here, so positive and predictable human interaction is really important. This is where things like in the fear-free world, touch gradient, come in, where it's the way we interact with our patients, how we touch them. If we are able to understand that they want our touching or not. Something we do a lot here at German Vets is we use the kitty handshake. So when we do have a cat that we need to interact with, we'll extend one finger. Often they will put their nose to it. And if they rub their cheek in, that's normally a little bit of an invitation for a bit more, which is great. We always want to see that. But if they're not interested and they turn away, we leave it there and we will look for another approach or a different person who's better. So really that predictable, we absolutely never scruff. There is never an okay time to scruff. There's never a reason to scruff. Scruffing prevents a cat from the ability to escape a situation, which is only going to increase their fear, anxiety, and stress, and is only going to make things more difficult for the veterinary team and for the patient. So we are absolutely a no scruff clinic, and I really think that that is something to impart in every clinic.
I just have a question. So by the sounds of like the no scruff, it almost, in terms of like, it almost, would you say it's almost, well, like using a table for a dog because they can't get away and they just kind of freeze?
Absolutely, and I think that the reasoning traditionally that vets and nurses would use it is because it's easy, or they just comply, or they let
just
it
kind
happen.
of shut down.
Yeah, they can just sort of shut down. But that is not a good thing, and that shutting down feeling is absolutely not something that we want patients to ever feel.
Got you. I've never actually thought of it that way. That's scruffing in the
Scruffing in the table is very, very similar.
I'm also learning so much about kitty cats.
So let me have a look at the pillars and see which one I've forgotten. Ooh, okay. So opportunity for predatory behavior and play. So that's really important. Cats, what are cats? Cats are hunters. They're solitary hunters. They are the ultimate hunters. Even a fluffy Persian at home, at the core, they're really a hunter. So we make sure that we have lots of toys all the time available. They can work just as well as a distraction, same like dogs, but different sets of toys. So they're on the other, we've got a bunch over here, which I think is, it's a cool area.
That is a nice area because it also gives the non-slip floor, so you can play with the kitty cats so they don't slip.
Except when I knock water. Yes, so that is really important, the non-slip. So in the UAE, we have tiled floors everywhere because it's so hot and that keeps things nice and cool. So we make sure to have a non-slip rug down, so if cats do want to walk around, they have somewhere they can get a good grip on. I'll show you a little bit about the bedding in a second, the same concept of non-slip. But we definitely always have some toys for cats. If they brought some from home, even better, something that's familiar. But we like to have some feather toys, some string toys that you can really pull along and imitate, I guess, the movement of a mouse tail is what I always think of, or a bird flying. Really important. And I would address this mostly to veterinary team members, my own coworkers included, is if you are playing with them with a toy, play, let them run around, up, down, but you need to let them actually catch the kill as well. So sometimes I've seen vets and nurses playing, and it just gets the cat or the dog, more and more and more and more aroused, and they don't actually get to destroy their prey. So it's really important to give them that opportunity, nice with a snack as well, but to actually catch it. So try to let them win, basically.
So it's almost like teasing them. So for example, I'm just thinking of like a dog situation. So it's almost like teasing them with a toy, but they never get an opportunity to tug. And that actually can cause more frustration than anything else, which can then potentially escalate.
Absolutely. And I mean, we know that cats, have a smaller spectrum of emotions than we do, but frustration is absolutely one of them. And that's something that we want to avoid as much as possible, as I'm being frustrated here. So play in general should allow for the cat to win sometimes. And definitely here in the clinic too, we like to, I guess, spoil them a little bit, and we should let them win more. So up on the tables, the big difference from the cat room to the dog room is we absolutely have tables. That's because cats like to be up high. They feel quite safe and secure up high. I guess the point is every cat is different, and we want to custom the experience for the cat who comes in. If we have noticed on the emotional medical record that this cat does like being on the ground or does like being on the owner's lap, that is where they will be examined. However, most cats actually feel quite at ease up high. So on your exam table, I think what I've seen at a lot of other clinics in the past is cats being examined on a cold metal table like this. Now, there's a number of reasons that's not super cat friendly. It's very cold, we know cats like warmth, it's reflective, not something cats really like, and it's just not homely, not nice, not good enough for cats.
It's probably also slippery, right?
Yeah,
so they can't actually find
slippery.
Stability when they stand.
Exactly. So this plastic matting is a great start. However, because cats are royalty and we want them to be as happy as possible, a few things that we would use to put under them is bath mats. Bath mats are just amazing. They are non-slip from the bottom, but they also have a nice thick texture. If we have an old cat or a cat who's known to be arthritic or a bit sore, we'd even layer that up and put a couple on just so we can make sure that they are as comfortable as possible. And then we can put blankets on top. So if I was seeing one of my own cats, an old arthritic cat, I would probably put the bath mat and then a lovely fluffy blanket like this. I like to have it folded over so that if you do need to use pieces of it, if you have a cat that does need a little bit of a gentle wrapping, then it's already set for you and you don't have to move the cat around. Or if they just need a little tent to hide in and you can tell that they want to hide, then you can make that for them. So lovely blanket folded across, and I would absolutely keep these brushes nearby. My favorite brush for cats is a just soft bristle brush like this. I think it really nicely replicates the tongue of a cat. So a mother cat cleaning her babies, this is the closest thing to that. If a cat's receptive to it, then it can be a really great tool to use. So I think I would finish talking about cat consults, prep and everything, with the two most important things for me. Number one is the pre-planning. So at GVC for sure, you'll see little teams within the team meeting sometimes a week or a couple days ahead of an appointment to discuss what that's going to look like. Who's going to be in the consult? Does that cat or dog prefer a male vet, a female nurse? What do we know about them? How can we construct the perfect visit for them? So we will do that every day here at the clinic, have these little pre-visit meetings, and we do that over our own time, and I think that it really just helps to make sure everybody's in the same zone. Now the second thing, and this might sound a bit woo-woo, but I'm gonna say it anyways, is that I've been doing this for a long time. As a veterinary professional, we know it can be extremely stressful. We can have very, very busy days. We're going from one consult to the next to surgery, having patients recover, and it can be very easy to enter the next consult full of fear, anxiety, and stress of your own. Now, I'm not sure exactly the science behind this, but I'm pretty sure that's not helpful to the patient that you're gonna see. Something I've been doing for many years is on a busy day or when I'm feeling stressed, before I enter the room, I will physically let it go, close my eyes, and get in my cat-friendly zone. Nothing else is important for those 20 or 30 minutes. I just come to a very centering place where I know I'm relaxed. I almost enforce that relaxation on my body so that that is what I give to the patient in front of me. I think that's super important.
Yeah.
Does that work for dogs? Have you ever tried that?
Yeah, I actually do a little bit of breathing. I'll breathe in for 4, hold for 4, out for 4 before going in. And I think just to add on to what you were saying there is we also just need to be cognizant, and that's where that real mindfulness and that, you know, really being absolutely present for that patient comes in. And we can do all the planning. We can look at the EMR. We can, you know, we can almost visualize how the consult's going to happen. However, we still need to focus on the patient in front of us. We can have this expectation that it's going to go X, Y, Z, but perhaps on that day, the pre-visit medication didn't work the same. Perhaps the owner forgot to give the pre-visit medication. Perhaps the dog is in a little bit more pain than we expected. And it's in that moment, it's following that fear, anxiety, and stress scale, reading the body language. And what's great is that everyone in the team, you know, we're almost like communicate without saying anything, because we are so familiar with what the patient is telling us through their body language, and we're so familiar with the signs of fear, anxiety, and stress and pain, that oftentimes we have to adapt things, and that's why we make sure we have a variety of options in the actual setting, in the actual consult room. So that's the only thing I would add, but everything else, yeah, no, definitely.
Cool. All right, well, I think we will pick another area of the clinic and topic for next time. So I think we'll do a live again in September.
Yeah, sounds good.
All right.
Alrighty, guys, have a lovely day.
See you next time.
Bye.